Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. It's a webinar where we talk about Lyme disease. I look forward to seeing what you have in store with me tonight and seeing what kind of a webinar you create with your questions. So the way that you can participate, there's two of them. Number one, you can just listen in and see what questions are asked and how I respond to those. But the other way is you can actually write questions to me too. And so to do that, over on the right-hand side of the screen at the bottom is a chat box. Write your question to me through there. I ask that you only click the enter key when the whole question is complete, because if you try sending me the enter key while you're writing it and try to create multiple paragraphs, it actually sends multiple questions to me, which makes it very complicated on my end. This is our last webinar for November. Next week, I'm taking time off to celebrate with myself Thanksgiving, as many of us will be doing that. I'm following the guidelines and not gathering with other people because we have COVID spreading out here. So I'm trying to be careful about that. But I won't be with you. I'll probably be sitting in Zoom calls with my family and friends celebrating Thanksgiving that way. I'm going to read the questions out loud, but for those of you that are participating in the live version here, you're going to get to see those posts on your screen, which will make it a little bit easier for you because you can actually read them yourselves as well too. Okay? All right. So without any further ado, let's go ahead and get started here. Hello, Ruth. Let's see. I'm just about up to the full dose of spirochetes back into persister form. I don't want to add an antibiotic. Rather, I'd like to go herbal. But anyhow, what Ruth is talking about, everyone, is we know that one of the reasons that people with Lyme are having a hard time recovering is that some of the germs can convert into what are known as persister forms. So Lyme has growing state and a hibernating state, and we call those hibernators persisters. The hibernators tend not to respond to the regular antibiotics that we use. And so the trend these days has been, and so then also there was discovered research done about 3 or 4 years ago now, showed that Disulfiram, which is a drug that we use to treat alcoholism, actually has the ability to kill the persister growth state of the Lyme germ. And so a lot of people, as they've been trying this, have been using the Disulfiram alone, which probably only address the persisters, and it may be missing the growing forms, okay? So you can kind of think of, so I want to clarify a couple terms. So there's two forms of the germ. There's something called a spirochete. That's the thing that looks like a corkscrew. There's also a cyst form of the germ, and spirochetes can morph into cysts, and cysts can morph back into spirochetes. Okay, all right. In addition, these forms of the germs have two different growth states. There's growing and there's hibernating or persisters, all right? So you can have persister cyst and you can have growing cyst. You can have persister spirochetes. You can have growing spirochetes, all right? So in there, although we don't know for sure what's the best way to do this because no one has done the research. And I know that some people theorize that if you try to treat growing forms while you're treating persisters is just going to complicate it. That hasn't been my experience, actually, because a number of my patients, I'm actually treating growing forms of the germs at the same time that I'm actually treating the persister forms, okay? When it comes to treating the persisters, though, a lot of the herbal protocols, one that you want to use, are all alcohol-based tinctures, all right? So the one thing you could do if you want to stay with the cat's claw would be to find a formulation of it. So the grapefruit seed extract is something that you can use to treat the cyst form of the germ, the growing cyst form of the germ. Grapefruit seed extract is something, cat's claw is something that can treat the spirochete form, may even hit the cyst form as well too. From what at least some of the petri dish experiments. So you could get a tincture that is a glycerin-based tincture, which is not alcohol. Okay, glycerin is not alcohol. Or you could look at getting cat's claw capsules. Okay, those would be some options for you to consider. Generally, though, I'm not even doing the herbs because there is a risk that some of these may have polyphenols in them, and polyphenols can even in dry forms, maybe polyphenols. So what I'm tending to do is actually using prescription antibiotics to treat the growing forms of the germ. Grapefruit seed extract is a little different. I think you're okay doing that. But I might do like a doxycycline coupled with grapefruit seed extract, for instance, and couple that with the disulfiram. All right? All right. Thanks for that question, Ruth. Good luck to you. Hello, Kathleen. Let's see. Hello, and thank you for answering our questions. You're welcome. I'm taking a high dose of L-lysine to treat Epstein-Barr virus. I've read that L-lysine should only be taken for a short time. Is this correct? And if so, how long? Also, I'm wondering about how all of my supplements are affecting my liver. BLT, lysine, numerous vitamins, magnesium, calcium. I'm also taking 900 milligrams of gabapentin for neuropathy in the feet and legs. One more thing. I have painful leg foot spasms in the middle of the night when I stretch. I had 5 last night. Recommendations. Thank you. All right. So for the leg spasms, I usually will try magnesium first. And I try to dose that anywhere up to about 600 milligrams at bedtime. All right. So that would be one thing to consider. I'm not sure how much magnesium you're taking, but that's how I would approach that. In terms of L-lysine, I don't see, in my practice, I use it on an ongoing basis. I'm not aware of why it can't be used on an ongoing basis, so I do. In terms of your liver, of the things that you're listed here, the BLT, lysine, vitamins, magnesium, calcium, and the gabapentin is the thing that would probably have the greatest chance of leading to some liver inflammation. And so you could support your liver by using glutathione. Glutathione is a strong antioxidant that is made in every one of our cells. And in particular, it's used in the liver to support the liver, but also to help with detox. Glutathione's job in every one of our cells is actually to fix injury and to prevent injury, okay? So if I've got somebody that I've got on a drug that might lead to liver enzyme elevation, I often will use glutathione. And I like using a liposomal variety of that. Liposomal means it's microscopically wrapped in fat, okay? And so what I like using is a product by Research Nutritionals called Trifortify. It is a liposomal variety that helps increase its absorption. They've got some great research that they've done that shows that actually their liposomal formulation is well absorbed and results in elevations of glutathione within the cells. Specifically in their studies, they looked at red blood cells. So I like using it for that purpose. If you do that product, the Trifortify, it's 5 milliliters one time a day. Another way you could support the liver if you don't want to do that, it would be to give it one of the building blocks to make its own glutathione. And to do that, that's something called N-acetylcysteine. And the N-acetylcysteine is a 500 milligram pill. I usually have people take one pill twice a day. It's one of the building blocks of glutathione. And if you happen to take more of the building blocks, you'll make more glutathione. Okay, so that's another option for you as well, too. I think I just answered all your questions. All right. Good luck to you, Kathleen. Hello, Diana. Let's see. For patients who are taking disulfiram, do you recommend taking high-dose probiotics? If so, which brand or type do you like? In general, does disulfiram harm the gut microbiome? If so, is it a lesser or the same impact as other antibiotics? That's a good question. So disulfiram actually, is working through a different mechanism, and we don't know for sure how it kills Lyme. No, we don't know. There's people that postulate how it might work, but we are not sure what the mechanism is. But it is not working as a classic antibiotic. And so I am doubtful, and I said doubtful, which means it's an opinion, that disulfiram is disturbing the gut microbiome. To be honest, there have not been studies done looking at that. What I can share with you is my experience now in using it over this past year with numerous people in my practice. I haven't seen people develop yeast overgrowth problems while they're on disulfiram. So I actually think that it's probably not hurting the good bacteria in the intestines, okay? In terms of high-dose probiotic, I usually have people take a soil-based probiotic, which is called Core Biotic by Research Nutritionals. And I usually have people do 2 pills of that 1 time a day. Okay? All right. Thanks for the question, Diana. Good luck to you. Hello, John. Let's see. Hi, Dr. Ross. Can shoulder surgery trigger Lyme or co-infection? Thank you, John. The shoulder surgery itself would not trigger a co-infection to get active, okay? It could trigger the Lyme germ to get more active. And let me talk about that here to tell you what I mean by that. So in people that get procedures that require general anesthesia means they put the breathing tube down your throat and you breathe in anesthetic gas, okay, through the breathing tube, all right? So that kind of sedation or anesthesia, for some reason, people that have Lyme, we tend to see that the Lyme gets more active with that kind of anesthesia. We're not sure why. It's been more of an observation that many Lyme doctors have, okay? So if you get abdominal surgery, for instance, they're probably going to do general anesthesia. Shoulder surgery, probably the type of anesthesia you're getting is general anesthesia. There are some type of procedures people have done that you can get something called conscious sedation, which basically means you're not really, so you're not getting the general anesthesia, but you are still asleep, and they do it by injecting medicines through your veins. That type of sedation, IV sedation, conscious sedation, does not seem to allow Lyme to get more active, okay? All right, now when I was saying Lyme, I actually mean the Lyme germ. I have not seen Babesia or Bartonella or other co-infections trigger when somebody got general anesthesia, okay? All right, thanks for your question, John. Hello, John, again. Hold on here just a minute. Hi, Dr. Ross. What infection would most likely cause optic nerve vision loss? So in terms of the tick-borne infections, in terms of vision loss, we need to think of things that can infect and affect the optic nerve, okay? And the 2 infections that I would consider would be Lyme, the Lyme germ itself, okay? But also the co-infection Bartonella is a possibility as well, okay? All right. Good luck to you, John. Hello, Crystal. Let's see. I hope you're doing well. Thank you. I'm actually just sorry. You may hear me sniffling here a little bit tonight. I'm a little bit sniffly, and I can't quite figure out whether it is some activation of allergies that I have from time to time, or whether I've got some kind of respiratory virus, not COVID, but a respiratory virus, which is kind of hard to get. I mean, many of you may know, I mean, in these areas where we're all been wearing our mask, we're tending not to get as many respiratory infections because the mask seems to block out those other infections as well, too. But anyhow, to answer your question, I've got something going on. I'm still trying to figure out what it is, but let me answer your question then. Let's see. Thank you for doing these Q&As. As I have let's see. Have any of your patients experienced side effects from taking methylene blue? If so, what are they? Is oil of oregano as effective in Bartonella treatment as methylene blue? Are there any advantages to taking methylene blue over oregano oil or vice versa? Thank you. So, in my practice, I'm seeing equal benefit between methylene blue and oregano. And that's, I've been using it probably for over the last 9 months to a year. I've been using both of them. I use them interchangeably. I also periodically will use both of them at the same time. Okay. So everyone, the reason I'm using oregano and methylene blue is based on research that came to us out of Johns Hopkins University that got published in November, I believe, of 2019, and then in April, we know that both methylene blue and oregano oil are ways to treat persister forms of Bartonella, and they appear to break up Bartonella biofilm. In addition, based on older studies that came to us out of the Johns Hopkins lab, we know that both oregano oil and methylene blue in laboratory experiments have the ability to help with persister Lyme as well too, okay? So I'm using both of them interchangeably, actually. In terms of side effects from the methylene blue, it can turn your urine blue. It can turn your stool blue, okay? The one potential problem I have seen, well, a couple things. I one time had a person that I put them on it and they developed allergic reaction. And the problem with that is it's a fat-soluble medicine, meaning things that are fat-soluble actually get stored away in your fatty tissues. And when they're fat-soluble, they take a while to get out of you. So if you're having an allergic reaction, it could take a week or so for that to quiet down. And that's what happened in the person. It is what we try to affect when we put people on Prozac and Prozac-like antidepressant medicines like Zoloft, Celexa, Lexapro, all those things that we use for depression. Many of them raise serotonin. So we have to be careful when we put a person on methylene blue if they're also on antidepressant medicines to make sure they don't get into something called serotonin syndrome, okay? That doesn't mean you can't mix the two together. It's just that if I've got someone I'm going to put on methylene blue and they're already on maximum high doses of Zoloft, for instance, I may think twice about putting them on the methylene blue, okay? All right. Thanks for that question. Hello, Mary. Mary asks, let's see, are those that get COVID having major Lyme relapses? You know, I've had a number of patients in my practice that have Lyme that have gotten COVID. And in general, I'm not seeing that they're getting Lyme relapses. The majority of people, recover from their COVID and do just fine. There are some of my patients with COVID that have become some of the long haulers in terms of their recovery from COVID. The difficulty is it's hard to tell when everything gets worse for them and they become a long hauler. Is that also a retriggering of Lyme? And the truth is we don't have a good way of knowing for sure. Okay. And so I decide if I'm going to retreat on the people that become long haulers that are having a hard time recovering from their COVID and they have had Lyme and they were in remission, for instance, I might add antibiotics back periodically. I kind of make a decision along with the patient on a case-by-case basis, okay? All right. Thanks for that question. Hello, Ruth. Let's see if one has active Epstein-Barr virus and potentially Lyme, what would you treat first? So Ruth, let me talk to you about chronic virus infections and whether we should or should not treat them. So I know a lot of my colleagues treat them. I don't. And I want to explain why, okay? So if we were to poll 100 healthy people, these are people that describe themselves as having no health problems at all, none, okay? If we were to pull 100 healthy people off the street and test them for antibodies against viruses like Epstein-Barr, human herpes virus type 6, cytomegalovirus, we would find approximately 20% of those healthy people have elevated antibodies against one of those virus infections. These are healthy people, all right? So finding elevated antibodies does not mean that the virus is active and is bothering you, all right? So the thing is about these viruses, Epstein-Barr, cytomegalovirus, human herpes virus type 6, human herpes virus type 8, parvovirus B19, these are viruses that live in us. They live in us the way that we have germs that live in our skin, and they don't necessarily cause us any problems because our immune systems keep them under control. We cohabitate with them. So if you measure your blood test and it comes back showing elevated antibodies, that means you've got these viruses in you. But it doesn't tell us whether the immune system has lost the battle and whether they actually have become too active and are actually hurting you. All right. It could be that these elevated antibody levels actually mean your immune system is doing a great job at keeping these viruses under control. So I don't really know if finding elevated antibodies proves that those viruses are a cause of fatigue or contribute to the fatigue or symptoms that people have with Lyme. Because of that, then, and because there's a great chance that these are just background infections that don't cause a problem, my approach is always to go after Lyme first. I usually don't look at and even start considering if chronic viruses might be a problem until about 9 months or 12 months into an infection, okay? And I usually make my decisions to treat not based on the elevations in antibodies, but rather I'll make a decision to treat for chronic viruses if somebody has elevations of another chemical, which is called nagalase. So what's a nagalase? Well, nagalase is an enzyme that is made in the covering of viruses. And if you find elevated nagalase, that means that you have elevated virus load in the body, okay, or elevated numbers of viruses. In other words, it's a way to see, do you have too many viruses? Did the immune system lose the battle? Okay. All right. And what nagalase does is it basically deactivates a chemical that's supposed to turn on one of your type of white blood cells that fight viruses called macrophages. So viruses make nagalase to make it so the immune system can't attack them. Okay, that's kind of what it does, all right? So if you have elevated nagalase levels, then that is some sign that you might have chronic viruses, and it's usually in those situations that I'll treat for them. In addition, when it comes to the chronic viruses, because the immune system is really what regulates them, my opinion is, even if they were to be there and I was solidly sure they were active right at the beginning of treatment, I wouldn't treat them anyhow. If somebody came to see me and they had Lyme and they had elevated nagalase suggesting viruses, I would go after the Lyme first, because probably what's happening is your chronic Lyme, when it's active, suppresses the immune system, allowing these infections to get active. And so the way to deal with it is treat the Lyme so you don't have as much immune suppression, so the immune system can put the viruses back under control. I will start looking for it, though, about 9 months, 12 months in treatment. If we're not making any headway, then I might start looking to see if viruses are contributing. Okay? All right. So let me do a quick screen share, because this is kind of a complicated area, but I'll show you an article that I've written that you can take a look at to get more insights on this. Okay? All right, everyone. This is my Lyme disease information site. I know you're all very familiar with it. I think you're familiar with it. Anyhow, if you're looking for my opinions on various things and ways to treat various problems in Lyme, take a look at the online Lyme guide that I have here. All right. And so take a look at, in terms of the viruses, take a look at this section called Infection Treatment Plans. And take a look at my article called When and How to Treat Chronic Viruses in Lyme, a brief guide, okay? And it outlines when I decide I am going to treat and how I decide if I'm going to treat. All right. Thanks for your question, Ruth. Good luck to you. Hello, Mary. Let's see. Are those who get COVID getting major Lyme relapses? I've been affected this way since spring when I was doing very well for over a year. I think I answered that earlier for you. Okay. Or I answered for somebody else. The answer is most probably don't. Some might be. It's hard to tell if it truly is post-COVID or whether it truly is Lyme that got reactivated. Okay. All right. Hello, Fiona. Let's see. What steps do you recommend taking in order to maintain remission? Thanks. So in terms of maintaining remission, let me just address a few things. So it's very possible that when we use herbal or prescription antibiotics, or we use some of these persister treatments like disulfiram or dapsone, that we may be able to get the germ out. And so what more and more what I'm doing and I'm seeing in my practice is if I can get somebody well and they remain well for at least 2 years, there's a good chance in those people that we actually knock the germ out. Okay. Now, I'm not just saying that based on my opinion. This is a topic that we had a big discussion in one of my Lyme, one of the ILADS discussion groups a while back. There was a discussion about this point. That kind of became the general conclusion. If you're symptom-free, or you stop treating and you have some symptoms when you're done treating, but they don't flare anymore over a 2-year period of time, we probably have gotten the germs out. Okay. Keep in mind that with Lyme, sometimes the reason you don't recover all the way is there can be some injury that's left even when the germs are gone. Okay. All right. But in terms of what do I do during that 2-year period to help retain remission and hopes that we really did get rid of every germ, what I usually will wind up doing is a few things. Number one, I want to support the immune system. And to do that, I want people to exercise regularly, if you can, up to your level of tolerance. Okay, don't exercise to the point that you pay the price the next day, but exercise turns the immune system on. Okay. Number two, I'd like for people to try to de-stress as much as possible. Do activities and do things in your life that help remove anxiety and tension, because it's stress that suppresses the immune system. Okay. So if it means going to church because that gives you some calm, go to church. If it means doing meditation, do meditation. If it means talking to a counselor periodically, talk to your counselor periodically. Do those things that help you de-stress. Okay, so de-stress and exercise. Okay, number three, make sure you continue to get good amounts of sleep of 7 to 9 hours or more a night. Sleep helps restore the immune system. Okay, number four, I suggest taking things that boost your immune system. So number one, I like people being on a mushroom mix. I like using a 5 mushroom formula, and because that turns on the cellular part of your immune system, part of the immune system that actually fights infections. And I usually use a complex called the Immune Builder 5 mushroom formula, and I usually have people take 1 pill 3 times a day. The other thing you can do is to use some transfer factors. Transfer factors are proteins made by some of the white blood cells that help target germs so the immune system will go after them, okay? And I like using a mix of transfer factors called transfer factor L+, made by Research Nutritionals. And it has in it transfer factors against Lyme, Bartonella, Babesia, Ehrlichia, Anaplasma, Chlamydia pneumoniae, HHV6, Epstein-Barr virus, and I believe against cytomegalovirus as well too. Okay, and that would be 1 pill twice a day. Let me show you where you can look at these recommendations in some detail. All right. Okay, so for information that I have written about this topic, take a look at I should have a section here called End of Treatment, I thought. Where are we here? Oh, here we are. Yeah, I do. So in this section called End of Treatment, and then look at how to prevent relapse, okay? All right. Fiona, thanks for the question. Hello, Andrew. Let's see. After years of misdiagnosis and multiple negative tests, I found a doctor that was Lyme literate. I have been on antibiotic treatment for 16 months, some improvement. Question is, how am I sure I have Lyme? So there's four things we consider when we're making a Lyme diagnosis. I'm going to answer your question, but let me start at this point first. So the four things we consider when we're making a Lyme diagnosis are: number one, was there a possibility it could have been given to you or transmitted? Okay, and the strongest possibility of that is if you had a tick bite that you know of. Okay, and it's really strong if you had a tick bite that you know of in an area where there's a lot of Lyme. Okay, but 50% of the time that people have Lyme, they don't remember a tick bite. And so then we have to consider, did you do activities that might have put you in contact with ticks, like hiking, hunting, camping out in the outdoors, living in New Jersey. The reason I said living in New Jersey is 95% of ticks in New Jersey carry Lyme. So, I mean, if you're living in an area where there's a lot of Lyme, that's a risk factor as well, too. Okay. So number one, let's see if you got risk. Number two, look at what the symptoms tell us. Are there a lot of symptoms that look like Lyme, and have other possible diagnoses that can explain it been ruled out, been taken care of? Okay. Number three, we look and see, are there any physical exam findings? I will tell you, I mean, there really aren't any physical exam findings that definitively, that for certain tell us you have Lyme. Okay. But we still see, are there things like an obvious neuropathy symptom or sign that you might have in an exam, for instance, okay? And then the fourth thing we consider is there a supportive blood test? Now, did you notice the word I said supportive blood test? I didn't say diagnostic blood test. And the reason I didn't say diagnostic blood test is a test can be wrong. No test diagnoses anything, all right? We still have to think clinically, does it make sense? Also, you can have negative testing that can be wrong, but you can have positive testing that can be wrong too. All right. So in terms of knowing if you had Lyme, if you had a known tick bite and you have a lot of symptoms that suggest Lyme, then that's one way of knowing. All right. If you want to reinforce that knowing by looking at testing, then you might want to repeat your testing. So if you are being treated for Lyme and there never was a positive test, you might, after being treated for it, go back and retest again. So the testing that we primarily do for Lyme looks to see, what do you have an immune reaction? So the tests fall into two categories. One is antibody testing. Is your immune system making antibodies? The other category they fall into is, are your T white blood cells showing evidence of reacting against the Lyme? Okay, so the immune tests are either a Western blot or something called an immunoblot. They look to see, are you making antibodies? And the T cell activation test, the test that says, do your T cells remember fighting Lyme? That is commonly called an ELISpot test. Both the ELISpot and the Western blot or immunoblot test can be negative if you have Lyme, if there's a lot of immune suppression. And so sometimes by treating Lyme with antibiotics for a year, 16 months as you've treated here, the immune system will turn back on, and then you can measure whether there really was activity, okay? In terms of, I think, the best test to look to see if you've had Lyme or currently or have had or have is to do a test which is called the immunoblot through IGeneX, okay? So IGeneX is a lab that's been perfecting Lyme disease testing. And this test technique they do called an immunoblot is something they developed a few years ago. And what it does, it looks to see, is your immune system making antibodies against 8 kinds of Lyme germs. Okay, that by itself makes it a better test, all right? The Western blot test that is done by IGeneX, they have a Western blot, is another way to look and see if you have antibodies attached to Lyme proteins. Their Western blot uses 2 strains of Lyme germs. And the Western blot test that is done by all other labs, including Health Canada and also our major health systems here in this country, looks to see if you have antibodies against 1 strain of Lyme, all right? So this immunoblot method that IGeneX has, based on their own validation studies, has the ability to find Lyme if it's in you 95% of the time. That's pretty good, okay? So that's probably what I would suggest doing. If you're looking for a definitive answer based on a test, then I would look at getting this immunoblot through IGeneX, okay? All Good luck to you. Hello, Heather. Hold on here, everyone. All right, let's see. Hi, Dr. Ross. My doctor is testing me for mast cell activation syndrome. He ordered a 24-hour urine and methylhistamine, prostaglandin D2 and F2, and leukotriene E4. I've heard you say that testing for MCAS isn't reliable. Are any of these tests good? Should I try to eat some high histamine foods before the test? Thanks. So the problem is we don't have a fully good test for, so anyhow, mast cell activation syndrome, everyone. Let me talk about what it is first, and I'll talk about the testing. So we have a type of immune cell in our body called a mast cell. And mast cells are where histamines are made. And so when we're allergic to something, the pollen or cat dander or whatever it is we're allergic to will attach to the mast cell, causing mast cells to make and release histamines. And then you get the whole histamine reaction, like the runny nose. You can get hives. Histamines can give you headaches. You can get a lot of abdominal cramping kind of sensation. Those things are all histamine reactions. Sometimes asthma can be a histamine reaction as well, too. Okay. Now, historically, we as physicians and those of us in the healthcare system only thought the only thing that turned on mast cells were things we're allergic to. But that's not true. We now actually know that other things turn those mast cells on and cause them to make and release histamines much easier than they might on their own, okay? So those other things that can turn on mast cells are mold toxins, yeast living in your intestines, Lyme and co-infections, and chronic infections can turn them on. Also, the other thing that really stimulates your mast cells is stress, okay? So one thing we got to make sure we do when we're treating people for mast cell activation syndrome, where their mast cells are overly turned on and overly reactive, probably triggered by chronic infection, probably triggered by things you're allergic to, probably triggered by yeast and even mold toxins. We need to de-stress. We need to take care of treating anxiety, stress, and tension, okay? But so what we're trying to measure in terms of seeing do you have mast cell activation is we're measuring things that get manufactured by those mast cells, like prostaglandin, like the leukotriene, like methylhistamine, okay? And the problem is that you have the greatest chance of finding those elevations if you're in the middle of a huge attack of mast cells, if you will. Most people are not ever always in an acute attack. And so it's hard to measure elevated levels of those, okay? So you can still have mast cell activation, but the testing will be negative. On the other hand, if you do all these tests and they come back positive, it can confirm that you actually have it, okay? My point is because the testing is so inaccurate, I usually decide to treat just based on what the symptoms tell me, okay? All right. Thanks for that question. Good luck to you. Oh, you don't necessarily need to eat high histamine foods before the test. I don't think that's going to change the outcome of it, okay? All right. Thanks for the question. So everyone, if you're interested in knowing more about mast cell activation, let's do a quick screen share here. Take a look at my immune system section here. And take a look at this link to my called mast cell activation syndrome in Lyme. All right, and so kind of just to go over the kind of symptoms you can have, there's like a very detailed list here. So for instance, mast cell activation, all these histamines can lead to fatigue, weight loss. You can get the common things like nasal congestion, itching, shortness of breath because it can trigger asthma, throat swelling, and wheezing. Okay, I'm going to really pay attention to those symptoms in terms of considering if somebody has mast cell activation. That is these specific respiratory ones. The other ones that could be a strong indicator are these ones under skin, which would be the flushing itching, hives, swelling in the skin. And some of the abdominal symptoms like abdominal cramping when you eat certain foods, those can be pretty strong indicators as well too, okay? All right. In terms of testing, I've written about the testing here, and then here's some of the treatments you do. You want to get decreased stress. I was emphasizing that. Try to get rid of the things you're allergic to. Treat the infections, remove toxins, lower cytokines, and then there's some steps you can take to stabilize your mast cells, okay? And the things I like to do for that are the herb called quercetin. It's a 250 milligram pill. You need to do 2 pills 2 or 3 times a day. Also, luteolin can be useful at doing this as well too, okay? All right. All right, thanks for the question. All right, let's see. Hello, Zachary. Hi, Dr. Ross. I have had ongoing issues with morphia when I was very young, and in the past I've experienced fatigue, joint pain, and a slew of health issues. I just started a pulse of doxycycline and Zithromax. I have struggled with acid reflux, especially at night. Was diagnosed with hiatal hernia and motility disorder. I would like to get off of the PPI and use natural product. Do you think D-limonase during a pulsing for fixing reflux is a good idea? Are there any supplements you recommend for GERD? So I don't know the herb called D-limonase, okay? I can't make a comment about that. I haven't used it. What I do like using for people that have reflux problems and heartburn kind of problems is I like using licorice. I like using a form of licorice which is called deglycerated licorice. And what that means when we say it's deglycerated licorice is there's a chemical group removed from licorice that called the glycyrrhiza group that if it's left on licorice could lead to high blood pressure, basically. Okay, so that's removed. The way to do it is you get these licorice tablets and you chew them. And you can chew them chew 2 of them before taking your medicine or before meals 3 or 4 times a day. All right. And what that does is your saliva interacts with the licorice and it can create a microscopic gelatinous coat that coats your food pipe and your stomach, protecting your linings from the acid, which eventually, if you do that, it sometimes can result in the valve that's supposed to sit at the top of your stomach that's supposed to squeeze tight to keep acid from going up into your food pipe. If you can control acid hitting the food pipe, sometimes that valve will start to work better on its own, okay? All right, so that's generally what my approach is, okay? All right, thanks for the question, Zachary. Hi, John. Hi, Dr. Ross. Can Lyme or co-infection cause white matter on the brain? So, John, Lyme can sometimes cause plaques or white areas to show up on MRI of the brain. Bartonella can too. Those would be the 2 primary ones, okay? Keep in mind, not all white things seen on MRIs necessarily are from Lyme, but Lyme can result in that. Hello, Geraldine. Can Candida cause symptoms similar to fibromyalgia? Basically, muscle pain, sensitivity, burning feeling in muscles intermittently. The answer is yeah, it can. So when you get too many, so Candida, by that I mean Candida or yeast overgrowth in the intestines, not in the muscles, but actually in the intestines, okay? So what happens when you get too many yeast living in the intestines, that can lead to body-wide inflammation. Keep in mind that 70% of our body's immune cells line the intestinal tract, okay? 70%, all right? And if you have too many yeast living in the intestines, those immune cells will see the yeast and they're going to react by making more of those inflammation chemicals called cytokines. Now, Now, if you've participated in my webinars long enough, you know I talk about cytokines about every time, okay? So cytokines, let's talk about those real quick. So cytokines are made by white blood cells whenever they see infection, toxins in us, okay? And their job is to turn the immune system on. So in the right amount, cytokines are good. So in the right amount, they cause more white blood cells to be made. They draw those white blood cells to where an infection or a toxin is, and they help those white blood cells work better. Okay, that's in the right amount, all right? But when the immune system isn't doing a good job, it's going to try harder and harder. And eventually it can make too many cytokines, all right? And too many cytokines make it so you can't think, give you fatigue, interfere with how your hormonal systems work, including your adrenals and thyroid, which makes fatigue worse, disturb your sleep centers in the brain so you can't sleep well, which makes your fatigue worse, all right? And those cytokines also lead to inflammation throughout the body, including your joints and on your muscles, so you get achiness from it, all right? So yeah, yeast can trigger a syndrome that looks like fibromyalgia and chronic fatigue, and sometimes yeast can make fibromyalgia and chronic fatigue worse as well, okay? So yeah, it can do all those things. Thanks for the question, Geraldine. Hello, Eileen. Let's say hi, Dr. Ross. Thanks for everything you are doing for all of us. You're welcome. Does the infrared sauna also kill Bart? Just got one and have some herxing. So far manageable. Thanks again. So I don't believe that the infrared sauna itself kills a germ. In other words, the light itself, the infrared doesn't kill anything, okay? But what infrared saunas do is they heat you up. And when you heat up, that causes your blood vessels to dilate, which sends blood flow further into your tissues, which means your immune system can get further into tissues and see germs, maybe kill them, okay? But also if you happen to be on antibiotics, either herbal or prescription, then you're going to get better perfusion of those antibiotics or prescriptions into the tissues, which can lead to greater killing. So you can have a herx from that as well too, okay? All right. Thanks for the question. Good luck to you. Hello, Marie Eve. Hello, Dr. Ross. Thank you so much for everything you're doing for the Lyme community. You're welcome. My question is, I have electromagnetic frequency hypersensitivity, which I always thought was related to heavy metal toxicity. But can it be due to Lyme, co-infections, or mold toxicity? Any device you could suggest using in the apartment or on a person for EMF protection? I tried a few and didn't feel much change except for an earthing mat. Do a lot of your Lyme patients have EMF hypersensitivity? Anything else I could do to help? Many thanks, Dr. Ross. So EMF hypersensitivity is something that I don't have a lot of expertise on that one, okay? What I can tell you, though, there are some people with Lyme and with Bartonella in particular that will have EMF hypersensitivity. And I do think for most people that actually is what it's coming from. In terms of the things to do with it is to avoid EMFs as best as you can, which means probably turning off your Wi-Fi devices, trying not to live under electrical lines, all right? There are some devices that you can use that will supposedly block those EMFs, but I'm not familiar enough with whether they actually work or not, to be quite honest. It's a rare person that I have that has EMF problems, and usually I, in my own practice, will wind up referring them on to somebody else who has more expertise in dealing with that than me, okay? All right, good luck to you. Hello, Lynn. Let's see. Hi, Dr. Ross. I had the Galaxy test July of 2019, and I was reactive for both Henseli and Cantana at the 1 to 256 titer. In September of 2019, I had an Igenix IFA, and I was IgG negative and IgM equivocal. Have had this IGeneX test several times before with the same result, except one time when IgM was positive. I should clarify that this is the Bartonella IFA test from IGeneX. I know you prefer their immunoblot, and I'm wondering if my follow-up test at this point should be an immunoblot, or should I stick with the same testing regimen so I'm comparing apples to apples? Thank you. All right. So IFA is a technique we use to see if you have antibodies that against a germ. Okay, it's one of the techniques that we use. And it's probably not as precise of a method as doing a Western blot. You're calling it immunoblot here, but it's actually, there's a Bartonella Western blot technique that is now being offered by IGeneX. Galaxy Labs does not offer it, IGeneX does. And what we do with a Western blot technique is we basically take Bartonella germs and we take their proteins, and then we see, do you have antibodies that actually attach to them? Okay, it's a way of doing it. I think that the most sensitive way of testing these days is actually that Western blot method. Okay, it has the ability to see if you have antibodies against the family of Bartonella, of which there are 15 kinds that can infect a person. And in addition, it looks to see if you have antibodies against 4 specific kinds, okay? And what that means is if you have antibodies against the family, but you're negative against one of the 4 specific kind they can test for you, that means you probably have one of the other 11 in you, okay? Now, in terms of doing repeat testing to see is the germ done or not, it doesn't work, all right? The reason is these are antibody tests. Antibodies will sometimes be suppressed if a germ is very active. So just going in and redoing an antibody test, whether it's an IFA or Western blot, and finding it's negative does not prove the germ is out of you. You could have negative tests because the germ is suppressing the immune system. All right. Likewise, having greater elevations or a more positive Western blot or greater elevations of the titer, meaning a stronger antibody reaction, does not mean the germ is more active. It just may mean your immune system is now more capable to deal with it, okay? So I don't believe in going back in and retesting. I know a lot of my colleagues are starting to do that. I think we as physicians somehow have become so ingrained that we have to do lab testing to prove something that we're incorrectly using these tests when we use them as a means of following where a person is. They're not reliable. The thing that's most reliable about how you're doing in your treatment is, how are you doing in your treatment? What are your symptoms telling us? If you still have a lot of symptoms of Bartonella and your test comes back negative, it may mean your Bartonella is raging in you still and your immune system is suppressed from it. So I wouldn't go back and redo any of these tests again. Lynn, thanks for your question. Good luck to you. Hello, Zachary. Hi, Dr. Ross. I'm currently being treated for Lyme and possible babesia. My mother also had chronic Lyme before I was born. I'm going on pulse doxine and Zithromax. I was wondering if, I think you asked that one already. Yeah. So that I already talked to you. That's the, I'd suggest that you use deglycerated licorice. Okay. All right. Good luck to you. Hello, Lynn. Let's see. Can you make any suggestions about addressing gut malabsorption that is causing weight loss? So the first thing I would look at is, why are you having malabsorption? What is under that? Okay. And so usually what I will do if I've got somebody that's having malabsorption is I'm going to do stool studies, and I'm going to do a comprehensive stool testing. I'm either going to do that through Genomic Diagnostics, or I'm going to do that through Great Plains Lab. And what those tests can tell me is they can tell me, do you have a good balance of healthy bacteria? If you do not, then we need to get you on some probiotics because healthy bacteria are needed to help do some of the food digestion. If you're not having good food digestion, you're going to have malabsorption. Okay. Number 2, on those tests, they're going to also give me an indication as to whether your pancreas is working well enough. The pancreas makes enzymes that help digest food. Okay. And so there's some markers on there that we can look at on these comprehensive stool analysis to see, is your pancreas working adequately to make enzymes? Okay. All right. So, and then the third thing that those tests do is they can also help me look at whether you have a type of inflammation we might see in something called Crohn's disease or ulcerative colitis. That's a chemical called calprotectin. And if it is elevated, then we want to send you off to a gastroenterologist to scope you and see, do you have one of those conditions as well too? All right. All right. So that's where I would start, is by getting a comprehensive stool analysis. And it's hard for me to say. I would need to know more about what that says as a means of telling you what's the best way to go about addressing your specific situation. Okay. All right. Thanks for the question, Lynn. Hello, Nancy. Let's see. I have horrible spasms, also tons of chelated. Nancy, I'm sorry. I can't remember what your original question was there. It looks like this is an add-on to that. Hello, Karina. Hello. Thank you so much for hosting this. You're welcome. I'm struggling with self-regulating my body temperature and getting extremely overheated, which leads to lightheadedness and eventually fainting if I don't cool down. I also have extremely itchy skin that comes and goes. I've been on minocycline, azithromycin, hydroxychloroquine for 6-ish months and recently started on nitazoxanide. That's Alinea, everyone. And the symptoms persist. Any advice or insights? Thank you. All right. So self-regulating body temperature and getting lightheaded and eventually fainting are symptoms we see when there is imbalance in your adrenaline, anti-adrenaline system, or we call that sympathetic, parasympathetic nervous system, or it's also known as the autonomic nervous system. And when people have problems in that part of the nervous system, we call it dysautonomia. Okay? All right. So it sounds like you're having some dysautonomia. Okay, so what can lead to dysautonomia? Well, number 1, Lyme can infect the vagus nerve, which is a nerve that comes out of your brain, the bottom of your neck. Bottom of the head, where the bottom of the skull meets your spine. There's a bunch of nerves that come off there called cranial nerves. One of those is the vagal nerve. And if it gets infected by the Lyme germ, you can get a lot of instability in the in dysautonomia and get symptoms like this, okay? The second germ that can also affect the autonomic nervous system leading to this is Babesia. It looks like, judging by what you've been using here, minocycline, azithromycin, and hydroxychloroquine, that somebody has wondered if you have Babesia and they've been trying to treat you for it. What I would let you know is that's not a strong way of treating it. The hydroxychloroquine, which is also known as Plaquenil, is very weak as an anti-Babesia agent, okay? Somebody has thought to use nitazoxanide now, which is Alinea, and it is not the most strong way of treating Babesia either. And so one thing I would consider doing is getting on a better Babesia treatment if you have Babesia. And I can't tell for sure based on what you've written here, but if there's Babesia based on your symptoms, then I would look at a different Babesia treatment. And I can show you an article that you can look at to take a look at that, okay? Secondly, I would also consider starting some salt. I'm taking up to about a teaspoon, maybe even up to a tablespoon a day of salt, either put across your food or dump it in water and drink it, because salt is going to expand your blood volume it's going to hold more water within your blood system, so that as you're going to tend not to get the lightheaded, racing heart kind of symptoms that you're getting as well too. Okay. Third thing to think about using that can be helpful when you get into a situation like this is something called low-dose naltrexone. Naltrexone is a chemical or a narcotic blocker, and it interacts with a group of receptors in our body called endorphin receptors. If we provide temporary blockades of those endorphin receptors, for some reason, I'm not sure the exact mechanism here, that it can sometimes help with your type of symptoms like you're having here as well too. Okay. All right. I'm going to do a quick screen share. I'm going to show you a couple of things to look at. Okay. All right. So first of all, see if you have babesia. All right. And so let me show you an article about how do you diagnose babesia. It's based on your symptoms. If you have a lot of babesia symptoms, then you should treat for it. Okay. So testing is not perfect. All right. But the major symptoms that you want to look at is night sweats can indicate it, temperature fluctuations, panic attacks, headaches in the front of the head, feeling off balance while walking, air hunger, racing and skipping of the heart, regular deja vu experiences. Those are symptoms that can suggest babesia. If you have a lot of those, then I definitely would be treating your babesia. Okay. Number two, in terms of how do you treat babesia, take a look at my infection treatment plan section here. And this is my, where is it? Here it is. Here's my article on how do you get rid of babesia. And in terms of, I offer some suggested regimens right here. Okay. And the one thing that I put down here at the bottom, all the way down here, is in my third tier, I put comments about alinea. And I say, I used to include this as a regular treatment, but over time, I don't think it works for babesia. Okay. And so I put those comments down here. But here, up here are I have two tiers of treatments, tier 1 and tier 2. Take a look at my tier 1, tier 2 treatments and see if your doctor can help look at getting you on one of these regimens as well too. Okay. All right. Finally, I did mention low-dose naltrexone. Let me just type it up here. So here's my article on low-dose naltrexone. Take a look at this, and it talks a little bit about how naltrexone works. Okay? All right. All right. Good luck to you. Hello, Joanne. Let's see. What is your opinion on IVIG as a treatment or preventive measure for Lyme and Bartonella? My daughter is an IVIG treatment, and red start marks have appeared on her outer thigh. Curious if Bartonella comes back, or perhaps she was reinfected. So IVIG is something that I will recommend in a couple situations. And one is if somebody has what's known as small fiber peripheral neuropathy, which means they have a certain type of neuropathy. The way we find out if you have small fiber neuropathy is if you're getting a lot of numbness, we biopsy the skin, send it off to the lab, and they look to see under the microscope, do you have small fiber neuropathy? IVIG is a recognized a treatment that does give benefit in that kind of situation. That's one situation I'll give it. The other times I'll think about giving IVIG is if I've got somebody that has has decreased antibodies. And the way to find that out is blood testing, where you do IgG levels. And if somebody has marked decreased levels of it, I will wind up doing IVIG too. Those are the only two situations I use IVIG in. I don't really find it beneficial in other situations in Lyme. In terms of could IVIG lead to Bartonella, probably not. The IVIG, just so you know, I'm kind of cautious about using it in patients unless I have one of those two situations that I just mentioned. One is having very low Ig antibody levels in your blood, or having small fiber disease. Using IVIG is not an innocuous thing. It's not a benign thing to do. Okay, number one, people can have some pretty strong immune reactions to the IVIG. All right. And so sometimes to manage those immune reactions, some doctors that don't know about Lyme will also then have a person take steroids to manage them, which can suppress the immune system, allowing Lyme and co-infections to get active. So make sure that your son, that somewhere in there, somebody's not giving them steroids to help manage the IVIG. Okay. All right. That's just not a good thing to do. Number two, these immunoglobulins and IVIG that are gathered come from multiple donors. All right. They have to draw blood from a lot of people to get enough of those Ig levels. All right. And although those donors are screened and the blood is screened to make sure that it's not infected with common things, it's still possible germs get through. So literally, when you're doing IVIG, you may be picking up other infections by getting blood products from multiple other donors, all right? So I'm very cautious about using IVIG in my practice. I need to have strong indications, and those two strong indications would be either small fiber disease, for which nothing else seems to be working in terms of neuropathy, or the second kind of situation that I might do it in is if I've got somebody that has really low antibody levels. Okay. All right. Thanks for that question, Joanne. Oops. Sorry about that, Marg. I think you asked me, what about Rife machine? My opinion on Rife machines. Let me just tell you real quick. So Rife machines, everyone, I meant to post it. I got rid of it. Sorry about that. So Marg asked me, what my opinion is on Rife machines. So Rife machines, everyone, are electromagnetic frequency generators, okay? And it was an idea that was developed by a guy named Royal Rife. That's why they're named after him. And the idea is that you can use them to kill germs. And so the theory is that if you find a frequency of electromagnetic frequency that is one that will vibrate with the covering of the germ, it can burst the germ and kill it. Much like if you were to have an opera singer sit in front of a glass of water, they could sing with a frequency and that it resonate with the glass and vibrate it and burst it. Same thing can happen with germs, in theory. Okay. Now, does it work? That's a mixed bag, actually. So in my own experience, in terms of what I see when people do try rifing and they tell me about the results they're getting, I find about maybe 40% of people get some benefit. Okay. All right. And then I'm not alone in this, because we now have good data that has been collected by a group called My Lyme Data, which is a project run by the on LymeDisease.org in California. They have about 12,000 people enrolled that fill out a questionnaire, and then they use that questionnaire to screen and find people to do further research. Okay, so these are people with Lyme that volunteer. So in My Lyme Data, last year's big project that they looked at is, do alternative medicines work? And if so, how frequently do they work? And what kind of side effect problems do they have? Okay. So I'm just going to show it, because I'm going to show you the table that they have for that. So, and I actually wrote a recent article about that. So let me just do a quick screen share here. All right. So if you're wondering, do various alternative medicine treatments work? Take a look in my latest section here. And here's this article called What Works? Navigating Prescription and Alternative Medicine Lyme Disease Treatments. Okay. All right. And in here, what they showed is, so this is a diagram from them. And what they were able to show is in terms of these are various alternative medicine treatments that people had tried. These are real patients, okay? And electromagnetic energy therapy right here, actually Rife machines right here, excuse me, helped 35% of people. The people found it moderate or very effective 35% of the time, okay? So that reflects what I see in my practice, okay? The reason I'm showing this article, if you're also, I know people want to know, does hyperbaric oxygen have an effect? This research project said maybe 22% of the time. Stem cell therapies, only 3% of the time, okay? Ozone and oxygen therapies maybe helps about 40% of the time. So this is real data, and actually their data reflects my own clinical experience as well too, okay? All right, so I just wanted you to know, those of you that are considering, I'm not just giving you an opinion, I'm actually have got some data that is kind of similar to what I see in my practice that comes to me from LymeDisease.org, okay? And their project called My Lyme Data, okay? All right. Marge, thanks for that question earlier. I'm sorry I didn't get to post it here. All right. Hello, Nancy. Let's see. I've had Lyme for 18 years, infected 2002, 2013, and 2020. I have EBV, chlamydia pneumoniae, mycoplasma pneumoniae, and CMV plus unknown other co-infections. Never treated until 2014. Never resolved. I have autonomic neuropathy, small fiber neuropathy, large fiber neuropathy, inflammatory arthritis. Really, I think that's bad osteoarthritis, CVID, etc. Where would you start? Antibiotics, herbals, beyond balance. I'm on Rocephin now. Nothing has helped. Lost sense of smell, etc. Okay. So, Nancy, to be fair to you, it's hard to say where to start. That's a lot. And I probably would, I would want to give you the best advice, I would want to talk with you. But in general, where I start is by dealing with Lyme and co-infections first. It's just where I tend to start with my treatments. The chronic viruses, usually if you get Lyme under control, they'll get under control. Mycoplasma and chlamydia pneumoniae are also common infections, even in healthy people. So just finding antibody evidence of them on testing does not prove they're part of your problem. In addition, many of the antibiotics that we use to treat Lyme will actually take care of those as well too, okay? In terms of your journey, I just want to let you know, My Lyme Data, that data bank I was just telling about, also has another project that they did that I write about in that article I was showing you, where they looked at what does it take to get well, right? And what they showed in their study, this is the one they just published for 2020, is they showed that the thing that managed to get people well is working with long-term prescription antibiotics. That is the thing that gave people the best chance of recovering. And that they showed that the people that had people that had the most chance of recovery were people that had been on antibiotics for at least a year or more. Number two, they were people that worked with Lyme literate medical doctors as well too. Okay, those were the two big findings that they had. All right. Now, the one thing I would tell you, Rocephin is not going to be enough. It just treats the spirochete form of your Lyme germ. Remember, Lyme lives as a corkscrew structure. That's spirochete. Excuse me. It also has the ability to morph into cyst forms of the germ. Okay. It also lives inside cells and outside cells. Rocephin is only good at treating spirochete by effectively knocking holes in the covering of it. Okay. It doesn't get inside cells where Lyme lives, and it doesn't do anything to deal with the cyst form of the germ. So in addition to at least that antibiotic, I hope your doctors are considering adding something that's going to take care of the cyst form of the germ. One of the things, for instance, you could use for cyst Lyme is grapefruit seed extract. And I hope they're going to give you something that's going to deal with intracellular Lyme. And that would be things like doxycycline, minocycline, azithromycin, clarithromycin, okay? I'm going to just show you a quick article that you can take to look at some of these concepts that I was just telling you about, all right? So in terms of treating Lyme inside outside cells and treating Lyme spirochetes and Lyme cyst, take a look at my infection treatment plan section. Take a look at my Lyme disease antibiotic guide where I talk you through how to build a treatment that will deal with Lyme living inside outside cells, and also I'm treating spirochete and cyst Lyme. I walk you through many approaches on that, okay? In terms of where to start when you have all these health problems go on, take a look at my treatment protocol. This gives you general guidelines of where to start. And number one, and it talks about things you should do throughout your treatment. Number one, do things to get sleep. That helps lower those inflammation cytokines. I give you some ideas on how to do that here. Number two, I suggest a paleo type diet. It tends to be anti-inflammatory. Number three, knock down those inflammation cytokines I was telling you about. Number four, be on something that helps your body deal with the stress. That's ashwagandha is what I like to use for that. Correct hormone problems. Be on a good multivitamin. Support detoxification with glutathione. Exercise to tolerance. If you can't handle exercise, don't do it. All of these steps above boost your immune system. Treat too many yeast in your intestines if they're there. Figure out if they are there. Get rid of Lyme. Treat your co-infections, okay? Those are the most important steps. If everything else is not working, then is when you want to start dealing with other things like mold toxin illness, like treating your chronic viruses, etc. Okay? All right. Nancy, you have a tough situation, obviously. To give you the best advice, it would probably help to do a consult visit with me. And meaning I can give you advice over the internet after I have a fair chance of considering the various testing you've done, all the symptoms. I could actually recommend a specific program that fits your situation. To do that, you would want to go to my my clinic website. And so to find my clinic website, you can just click on the clinic link up here on my Lyme information site. And this is my clinic's website. This is my practice called Marty Ross MD Healing Arts. Click on my appointments page there. And I describe here my limited consult service or full medical service. Read all about the details of each of those down here. Okay. Other place to look is on my frequently asked questions page here, where I go through a lot of different questions you might have. Okay. All right. Good luck to you, Nancy. All right. Listen, everyone, I know it's about 5:20 here, but I'm actually going to stop. My voice is starting to give way. I think I've got a little bit of a viral something going on here right now. Or it's just bad allergies. but I know I need to let my throat take a break after doing clinical care here the whole day and then doing the webinar. I'm kind of pooping out. So it's good to have been here with you tonight. Tomorrow morning, I will be getting an email out to you, hopefully by around before 9 in the morning, that will have, we'll let you know that the recording is done. I have an outline of what we discussed tonight. And it will also have a link to sign up for the next series of webinars, okay? I have a request of you. So if you like what we're doing here and you get help from it, remember others might be able to get help from that too. So I'd appreciate if you'd share what we're doing. Either send them the emails after you get them or talk it up. Let people know about the information site that I have and these webinars. I want to try to reach as many people as I possibly can. I want to help as many people as I possibly can. So I hope you'll join me in doing that as well too. All right. Good night, everyone. And have a great Thanksgiving, everyone, whether you're Zooming it with your family or whether you're actually able to have some of your household members with you for the holiday. All right. Good night, everyone.